You're all very welcome. This is the second Wednesday in a row we've had a look at how Belfast and its different constituent parts responded to the initial wave of COVID-19. The idea is that we just facilitate a conversation amongst ourselves, and we're going to hear from three speakers, three presentations, which will look at three different elements of how we connect with our urban and our overall environment. My name is Brendan Mulgrew, and I've been working as an advisor to Belfast Healthy Cities for a number of years now. And my job today is to introduce the speakers, to facilitate any questions that come in during the presentations, and generally to move things along. And we know from the evaluation that we've had from previous events that people actually appreciate that the sort of shorter, snappy, or succinct nature of these events. It's interesting. One of the comments that came in after last week's was, it's almost easier to attend an online event such as this rather than leaving your office to drive to a location and give up half a day out of your office. Where in reality, we can now do an event like this in about an hour and 15 minutes. And we will aim to finish at about 1:45 or very, very shortly after that. We do want to facilitate the three speakers, each of whom made this presentation to the WHO Healthy Cities Network annual conference, which of course also took place online this year. That was in St. Petersburg. So before we move on to the speakers, just to let you know that as attendees at the conference, you will remain muted with your camera off, but that does not rule out your participation in the event. If you have any comments, any questions for our speakers, or just a contribution to the overall debate, please submit those using the Q&A box at the bottom of your screen, not the chat box, which is not enabled during these Zoom seminars, but the Q&A box. We do want to get a wider conversation going on too, so if you feel inclined or motivated to tweet about anything that you hear, please use the hashtag #HealthyBelfast, which is displayed on the screen or was displayed on the screen. And I want to let you know as well that the presentation slides from each of our presenters, as well as the overall event, which is being recorded, will be uploaded to the Belfast Healthy Cities website, certainly by the end of this week. So as I've said, we have three speakers today, all from Queen's University: Dr. Ruth Hunter, Rachael Black, and Dr. Deepti Adlaka. And we're going to start with Ruth. So Ruth, if I put you on notice now that I'm going to ask you to start in just a moment, if you can get ready to share your screen while I introduce you, please. Ruth is a reader and associate professor at the Centre for Public Health at Queen's University here in Belfast. Her research explores population level approaches to the promotion of active living by evaluating public health effects of environmental and policy interventions. And Ruth is well known to Belfast Healthy Cities, and we have heard Ruth before talking about the study funded by the National Institute for Health Research, Is 20 Plenty for Health, which is around 20 miles per hour speed limits in Edinburgh, and which have also taken hold now in Belfast. And today we're going to hear mainly from Ruth around the evaluation of public health impact on the Collinswater community greenway. So Ruth, if you're ready to go, I'm going to hand over to you. Thank you.
Great, thank you, Brendan. Hopefully you can see my screen and you can hear me. Brendan, you let me know.
Yes, we can. Yep.
Neither is the case. So I'm going to switch my camera off for the presentation, just because my bandwidth isn't great, but I'll switch it on when it comes to the Q&A. So thanks for the opportunity to give this presentation to a more local audience. As Brendan said, my name's Ruth Hunter. I'm a reader in the Centre for Public Health at Queen's University Belfast. And I'm going to talk today through a study that we did and present the findings from a social return on investment analysis that we've done on the Collinswater Community Greenway. What's on the screen there, this paper has been published. It's in the journal Cities and Health. It's open access, so you can either access it through the link that's there, or feel free to email me and I can provide you access to the full paper for anyone that's interested in finding out more. So briefly, our rationale for doing this study. We know that economic evaluations are important to support the future investment in urban green space interventions, and evidence supports the multifunctional nature of urban green space interventions. And I've put a reference to another paper at the bottom there where we've reviewed the evidence base for urban green space and its impacts on health, the environment, well-being, society, and also its equity benefits as well, and also the economic impact that it can have. So we argue here that our economic evaluations of these urban green space interventions should have a broader lens that capture this full impact of urban green space interventions. However, to date, economic evaluations, when they are conducted, tend to be viewed through what we've termed a unidimensional lens. So they either look at particularly the health impact or the environmental impact, but rarely do they look at the whole picture and bring the various different impacts together. So given the evidence from that previous paper for a range of health, well-being, social and environmental benefits of such urban green space interventions, we then look to model the potential social return on investment of the Conservative Community Greenway in Belfast. Our work was underpinned by the logic model, or the conceptual model that's on your screen, which really highlights the intended benefits and also co-benefits of these types of green space interventions. So as well as modelling the economic savings, for example, from health benefits, we were also interested in other economic outcomes such as employment and labour opportunities afforded by the Greenway, the tourism impacts, increase in land and property prices, savings from the extensive flood alleviation schemes, and also the economic impact of reduction in crime. I'm sure most of you are very familiar with the Conservative Community Greenway, but for those of you who aren't, I'll just briefly give an overview of that. So the Greenway itself, we've been doing research at Queen's with the team Eastside Partnership for 10 years now, and it really afforded an opportunity to evaluate the public health impacts and beyond, really of what a new urban greenway can bring to a city, including the economic impact. For anyone that wants to know more details about the study itself, I've got a link to the study design at the bottom there. But for context, briefly, the Greenway development involved the creation of a 9-kilometre greenway running along 5 kilometres of 3 remediated rivers. There's a total of 16 kilometres of new or improved foot and cycle paths. There's a new civic square for encouraging social cohesion, improved connectivity through 23 new or improved bridges. There's signage, multi-use games areas, and also an £11 million flood alleviation scheme. Other aspects that are kind of showcased in the photos on the screen included lighting for 24 hours a day for improved safety. There's extensive landscaping and biodiversity, public art, and also numerous events and volunteering opportunities to animate and promote the space. And this is very much in East Belfast an area of need. So just to further add to the context, the area in which the Greenway is developed has some of the highest rates of unemployment in Northern Ireland, the highest levels of free school meal entitlement, and some of the poorest health levels in Northern Ireland as well. Okay, so what did we do? Our methods were broadly conducted in 3 steps to do the social return on investment. So in step 1, we identified key areas that the Greenway was aiming to impact upon based on reviewing the literature and also talking with stakeholders from a range of different sectors and community representatives. And so the areas that the Greenway was purported to impact upon included land and property values, flood alleviation, tourism, labour, employment and productivity, the quality of the place, climate change, and also health. And we hypothesised that the Greenway would provide an amenity to those who wish to be, for example, more physically active, to increase worker productivity and reduce absenteeism, to provide job opportunities, to reduce antisocial behaviour and crime, to increase tourism through promoting the space to visitors to the area, to reduce the risk of flooding, and to mitigate climate risk through change in travel modes, say, for example, to shift people from using the car to encourage walking and cycling. Then in step 2, the most recent and applicable evidence for each of these areas was summarised to obtain an effect estimate, and this was then applied to available data for the Greenway area and the impact estimated and monetised using various different economic methods. And then the final step was really then to calculate the benefit cost ratio of these 7 monetary benefits were summed for what we term a worst case and best case scenario. And this was then divided by the total investment cost. And when we did this, that was around £35 million. So this table then just provides a list of the 7 areas that were modelled alongside a brief description of the effect estimate that we modelled. In the interest of time, I won't go through the table in detail, but I'll walk you through one example to illustrate our approach. So for property values, the data to calculate the net economic benefit of increased property prices included looking at the number of properties impacted upon the Greenway, the average house price for the area, and the rates for property tax for the area. And then we modelled the expected return if, for example, property values were to increase by 2, 5 or 10%. For flood alleviation, this was based on number of properties protected from flooding. For climate change, this was based on the conversion of car trips to cycle trips. For employment and productivity, it was based on reduced absenteeism due to healthier lifestyles and increased productivity. For tourism, it was based on the number of Greenway users to the area. Quality of life was based on reduction in crime due to increased lighting and the 24-hour-a-day lighting of the Greenway. Biodiversity, I've included here for completeness to say that we did consider it, but we weren't able to identify suitable data for the model at the time that we did this work. And health, then I'm just going to illustrate in the next slide. So there's a separate piece of work that details the impact of the Greenway in terms of health, and I've put the citation to the paper if anyone's interested in the corner there. So here we modelled the potential impact of the Greenway on burden from colon and breast cancer, from ischemic heart disease, from type 2 diabetes, and from stroke. And the bars on the graph on the chart relate to if 2, 5 and 10% of the local population shift from being inactive to being active. So that means if they move from not meeting the current recommendations of doing at least 150 minutes of moderate level activity per week to them meeting that level and above, then the incidence of cases and numbers of deaths from these diseases could then be prevented. And really what these charts show, that even if 2% of the local population made that shift from being inactive to being active, then the Greenway is cost effective and in essence pays for itself. Although we acknowledge that these direct health gains are predicted to be small if we look at any particular individual. If you sum that over an entire population, they really are substantial. So these are just the summary of the monetary benefits in descending order from our social return of investment. And what we've summarised here is the worst and best case scenario. So just as a reminder, to calculate the benefit cost ratio of the Greenway, we summed all the 7 monetary benefits for both this worst and best case scenario and divided that by the total investment of the Greenway. And here we can see the benefit cost ratio of the Greenway to be positive and range from about 2.88 to 5.81. We found that the anticipated increase in property prices due to the Greenway would likely generate the greatest potential monetary impact through increased rate payments. The second and third largest monetary benefits were attributable to healthcare and avoided savings from flooding, and the fourth was due to cost savings from reduction in crime. And these top 4 monetary benefits really far outweighed any of the other benefits. Just for completeness, this table then presents the results from a sensitivity analysis, and here we've varied for those interested, the various discount rates and lifetime of the Greenway. And here we find again that the benefits cost ratio to be positive and range from 2.28 to 4.55 when the discount rate was set at 5%. And similarly, the benefit cost ratio was positive when the lifetime of the greenway was estimated to be at 10 years. So what does this all mean then? So in summary, the benefit cost ratio ranged from 2.88 to 5.81, and this means that for every £1 invested in the greenway, there would be an expected return of between £2 and £6, demonstrate that the greenway is very much a worthwhile investment. So just to wrap up then, the social return on investment analysis demonstrates that the greenway is very much a worthwhile economic investment. It should pay for itself between 2 and 6 times over the lifetime of the greenway, based on that estimate that for every £1 investment, there's an expected £2 to £6 return. However, should be noted that some of the data and evidence and assumptions were uncertain, and economic issues such as displacement and dead weight couldn't be accounted for. But in contrast to traditional methods of cost effectiveness analysis, social return on investment analyses allow for a wider range of these outcomes to be captured, and I think present a truer picture really of the health, social, environmental, economic and equity benefits of these types of green spaces. So thank you for the opportunity to present these findings, and very happy to take any questions. Thank you.
Thanks, Ruth. Very interesting, Ruth, and I would imagine that probably the majority of people who are attending online would know the Greenway or spent some time on the Greenway. We do have a couple of questions there. And some maybe they're straight in at the deep end. So look, I'll put them to you. First of all, from Josh Murray, and you may not be able to answer this, Ruth, but how does Greenway investment compare to that of roads? And we know that in Belfast and like other major cities, there can sometimes be a major emphasis on roads. Is it possible to compare the two in terms of public policy investment, Ruth? And your mute is just on the moment to let you know that before you come into an answer.
It's a good question. It's not one I can answer. Say what we've tried to do with this piece is very much try and build a fuller picture for urban green space. Say typically we have health impact assessments or environmental impact assessments, and really what we're trying to do is build a fuller picture, and I think a truer picture of the wide variety of expected benefits that these type of investments can make. I don't know how that compares to road investments, for example. So
okay, Ruth, there's another question that's come in. There's a couple more for you. If you could just stop sharing your screen in the meantime, that'd be great as well. Anne Madden points out that the Greenway is fully lit 24 hours a day, and she's wondering, are there any detrimental aspects to this around biodiversity? Has any study been done on impact on local wildlife? Is that an issue, Ruth? Is that something that's on your radar?
Yeah, that was very much something that was on the radar of the Consort Community Greenway team when they were developing the Greenway and also advocating for the lighting. So I know there's a lot of work that's went in behind the scenes in terms of placement of the lighting and also the different types of lighting that the biodiversity and wildlife are, the impact on them is certainly considered. Okay.
Ruth, one of your slides showed very effectively the economic savings which can be made in the long term. If only 2% of people who live in the area or who had access to Greenway used it, the savings were very, very significant, but they were also very long term. I just wonder, have you any thoughts around, sometimes governments work in election cycles, what pays off in the next 4 years or 5 years? We are looking for long term considerations here. Is it hard to get government, local government, central government to take that longer term view of public policy?
I mean, I think examples and successful examples like the Consort Community Greenway greatly help us in public health in terms of making this case. Public health it's a long-term investment. There are no quick fixes with it. And those benefits that we've seen and that we've modeled here can really be substantial, and also with the types of interventions that are put in place are there long term. So I think investments like the Greenway and being able to show how successful they are has greatly helped, and there's certainly lots of discussions and also investment from local government and from the likes of Department for Infrastructure and others in terms of green spaces. So I think
and it's great. It's great to see that long-term view being taken. Finally, Ruth, and actually a question which will probably spill over into Rachel's presentation too. Are there other? I mean, I think everyone would acknowledge the success of the Comber Greenway, and the number of people who use it. It's quite uplifting to see it. Are there other parts of Belfast that, in terms of topography, geography, layout, is there any other untapped areas that might lend themselves to a similar investment and a similar regeneration as a Greenway?
Yeah, I mean, yeah, as you say, the Conservative Community Greenway has been excellent and a real beacon, I think, in Belfast, as have other green space infrastructures as well. Department of Infrastructure have a plan and have a vision, very much through informed by some of Jonathan Hobbs' work in terms of investing in greenways and using, for example, disused railway lines, etc. Yeah. So I think the mood music, let's say, is very positive in terms of future plans and investment that's going into green spaces and greenways.
Okay, all right, Ruth, that's terrific. Thanks very much, and thanks for taking those questions at the end as well. Rachael, we're going to move on to you now. If you could ready yourself in a moment or two to begin to share your screen and go through your presentation. Rachael is a Queen's University PhD student. She's currently completing her PhD in planning, looking at how co-designing a shared future and how children can be a part of reimagining Belfast interfaces. And there's a large emphasis of the work at Belfast Healthy Cities too, is how to incorporate, how to make Belfast a city for all, from our youngest citizens through to the oldest. But we've always emphasised at Belfast Healthy Cities the need to facilitate how the incorporation of children's views into planning decisions and how to we might imagine Belfast in the future. And Rachel would say that children are key in the regeneration processes and in fact are the true experts in their community. So we're ready to hear from you now, Rachel. Can you start to share your screen and come in there, please?
Yes, can you see it okay?
Let me just move along. Yes, that's it. Thank you.
Perfect. Thank you very much for that introduction, Brendan. And just to reiterate, I'm Rachel and I'm from Belfast, and I just want to talk about, this is a project that was undertaken within my local community, and I want to further talk about how this research is going to be continued to be carried on. So Belfast, it is the city and it's still scarred by its recent histories, and among the legacies of the Troubles are its peace walls, which are solid barriers erected to separate and divide opposing communities at interface sites. And I'm sure a lot of you will already be familiar with these, but for those who aren't, they were first erected as temporary measures in 1969, and the number of walls has now increased to nearly 100 in Belfast alone. But in response to the challenges caused by interfaces, Northern Ireland's devolved government did launch the Together Building United Community, the TBUC strategy, in 2013, which had a very ambitious target to reduce and remove all interface barriers by 2023. But despite this initiative, the authors contend that there still remains extreme lack of meaningful engagement and consultation to gather transformative solutions, which are both short and long term. And there are clear gaps as to effective consultation and quality facilitation of local visioning. Therefore, not only do targets need to be reassessed, there is a need to generate transformative solutions to restitch the divided city of Belfast, and the people to lead such a process can and should be those who live within interface communities. So how our areas are reimagined will have a huge bearing on how our interface communities engage with each other and the wider public life in the city. As these decisions will impact upon future generations, it is essential that planners and policymakers understand the variety of children's experiences and the implications of their decisions on the inclusivity of Belfast. The presence of peace walls therefore impacts the way in which children living in interface communities perceive their own spaces, community and the city, And this is especially the case when remembering that the poorest of neighbourhoods in Belfast continue to be those located in and around interfaces and flashpoint areas, which in turn have resulted in high levels of disadvantage. And it was with this tenet in mind that the 2019 placemaking summer school programme was designed. So the site that the placemaking summer school programme looked at was Distillery Street, and this is located within West Belfast. It is about a 10-minute walk to City Hall and under a 5-minute walk to Royal Victoria Hospital. So it is quite central to the city. And as you can see, it is separated by the West Link, which acts as a huge barrier dividing both communities. And the site itself is a large green space and it's not very aesthetically appealing. There's a lot of graffiti and walls still included within this site, and it essentially hugs the back of the Grosvenor estate. There are only two main entrances into the site, which are located from Roden Street and to Distillery Street. And as you can see, it's just off the Grosvenor Road. So the placemaking summer school was conducted over 4 days in the Grosvenor Community Centre, and it engaged around 20 children between the ages of 7 and 15. And the overall aim was just to get genuine engagement from local children. And the objectives of the summer school included undertaking a site visit to gauge children's thoughts, opinions, and aid their visualisation, then to conduct some workshops to learn different ways to analyse a site and develop design ideas, and then holding an Adobe Photoshop workshop in the School of the Natural and Built Environment at Queen's University, and also a Queen's University tour. So on day one, Naya and Water had actually came out to the community centre just to give a talk and to kind of show some kind of attention around sustainable urban drainage system, which is a good option for the Distillery Street site. And this talk really just allowed the children to be more educated on what a SUDS programme is and how this can benefit the site and the local area. And after this, we then conducted a site visit of the site. And during this, we had asked the children to start thinking about some of the good things and the bad things that they can think of their area and what they see and what they like and dislike. And then when we get back, we had just used sticky notes, which are very, very cost effective, and asked the children to write one word per note on what some of the good things were and what some of the bad things were. And at the end of this day, children were then given disposable cameras, which allowed them to take photographs of images, what they liked and didn't like on their journey home and in and around their own area. And as you can see, some of the things that they did like about the site was it was massive, it was grass, it was private, and they had loads of room to dance. And these are some of the images of the good things that they liked in and around their area. And as you can see, Dunville Park was one of them that they included, and this was because of the large green space and some of the play activities. They also included an image of the local park within the community centre and the 3G playing fields. And then they took images of paving in somebody's front garden, some flowers as well in a local garden, and then just the path that they really liked that was put in. And their favourite things are the rocks that they all like to hang out in, and that was also photographed. So then we moved on to looking at some of the bad things, and these are some of the words that they had feedback when we were discussing the site. And the site is actually, it does host a local bonfire, which, you know, has significantly decreased over the years, but Belfast is still a very complex city, and you'll see this towards the end of the presentation. So these are some of the words that they used to describe it, that it was disgusting, and because people think that they can dump anything there. There is fights in the site, and mainly this site does have a lot of antisocial behaviour during the summer months. And again, it's dangerous, no nature and pollution because of the burnt wood. And as you can see, the stark images of the stuff that they took, which they didn't like about the site, you've burnt out bicycles, you've parking, barbed wire, graffiti, paint through over, and you know, they are very unappealing. And especially when you put it into context that this is a space that children use very, very regularly as their local play area. So on the second day, students from Queen's University, the School of Planning, had come out just to kind of develop some different type of design techniques on how they can analyse their local site. And they work with them in developing different types of maps, such as legibility maps, land use, and mental maps. And here this was done by just using tracing paper over a large Google Earth image. And the children were then able to pinpoint where actually they live and their routes to school, which was very helpful in terms of discussing with them their journeys and how they coordinate themselves around the area. So it was quite useful to gauge their perceptions of how they think, the ease of movement throughout their local area. And then after this, we started to brainstorm some ideas of what they would like to see on their site. And again, this was simply done by using Post-its on pieces of paper. And some of the ideas were urban beach, art room, play space, and they really wanted speakers on the rocks, which I thought was so creative. Costa coffee, a fountain, a racetrack. You know, the ideas were just so creative, and there was a lot of them. They had a lot of ideas about the site. So it was easy for them to write these on the post-its, but we wanted to actually show them different ways of how can you visualize these ideas. And we had simply used iPads, and a lot of them already had mobile phones. So then we asked them to start Googling different images of what they were trying to explain. And this was very helpful, especially for the next day where we were taking them to Queen's University to actually implement their ideas through a Photoshop workshop. And here on the third day, the children were taken over and they got a tour of the university grounds, which was very, very great. And they all really, really enjoyed it. And thankfully, the weather was on our side. And as you can see, you know, they were just having so much fun running around the grounds. And they were just really encouraged that university is an achievable step that some of them had never thought about. And they were so excited to actually see the proximity of the university to their local area. And here they are in the School of the Natural and Built Environment, where they had been undertaking the Photoshop workshop. And we simply saved the photos that each of them had selected that they thought they liked as the best practice. And then they were able to cut and paste this and put it onto the site, which allowed them to actually visualize their ideas and thoughts. And here's just some examples of the ideas that they had, you know, that large swimming pools, but this actually feeds into what NI Water was talking about with the SUDS programme in terms of rain gardens and living with the water. So some of their ideas may seem far-fetched, but there is actually realistic ways of implementing and incorporating these ideas into real life scenarios. And then they had trampolines in the grounds and fire pits, seating areas, and they really wanted to colour the rocks, which could be done very simply by using spray paint. But of course, that would need to go through the correct protocol. And again, here's just some more of the images that they've found online that they'd love to see and within that local space. And you know, simple things like even football nets had come up as well. And I thought the idea of an urban beach was great. So then on the final day, they had to present at Riddle's Warehouse in front of some lecturers and professors from the School of the Natural Built Environment, as well as students and some members of the public. So we started to gather all their images that they had done throughout the week and just paste them onto paper. And here then when we went down, we simply just used blue tack and got everything pasted onto the wall. And it was quite an informal setting. And of course, some of the students were a bit nervous, but then they all started to warm up and they really wanted to start talking about their ideas more as they got a lot more passion as the day had went on. So here's just images of them trying to describe, you know, what their ideas and the rationale behind them. And the good thing is that the site has actually progressed in terms of improvements. And as you can see, the before photos up the top, you know, there was a huge wall already existing, and that was kind of removed, as well as a path put in. And you can see this path didn't exist, but there was natural desire lanes where people do use this space in terms of dog walking and just to play. Then the palisade fencing, a lot of that was removed, and it's just completely made the site look more aesthetically pleasing. And local residents had actually painted the graffiti, as you can see from the wall up here and down here, it's now brown. And that was just done by local people starting to see engagement within the site and wanting to get involved. And this just really created a sense of pride within the area. And during the live site progress, the housing executive was involved in tree planting, and they were very keen on getting the children to be involved in this process. And as you can see, some of the kids, you know, planting the trees and putting down the seeds, which is just a good way to keep them, not only to get them involved in the idea process, but to keep them involved throughout it, because it is important not to just engage and then never talk to them or engage them again. They have to be included within each stage. But unfortunately, lockdown was tense enough as it is, and this just really illustrates how complex the city still is in terms of interface areas. Because children and young people faced a lack of routine, loss of school and face-to-face support services, more children and adults started to use this space for play and outdoor pursuits, mainly due to its convenience and its size, and it's so local to the actual residential homes. But this also led to increased pollen gathering at an earlier stage and some associated damage. And this period increased the risks for children and local residents. And unfortunately, the site became a danger spot and witnessed a major negative event. And Distillery Street made local, regional, and national news for all the wrong reasons when there was so much good being done. But this really just illustrates the need that there is to develop these sites that have been left behind from peace walls. and the need for the community to be engaged during this, as this isn't just the only site that this has happened in. This happens across multiple interface sites left behind by the peace walls. So to conclude, the three main things that worked well in the programme were independent and conclusion, and this I thought was done well through the use of activity packs, which just included a button folder, a sketchbook, some sketch pens and pencils, pages and maps. And it really allowed for the children to feel a sense of importance, as it was their own project. And some of them were actually referring it to as their briefcases, like they were going to work. And this just gave them independence to continue working at home, illustrating their thoughts and ideas. And it also allowed for some of the younger children who were quite shy to be included during the process, as they were simply then just pointing to their books if they didn't feel comfortable speaking up in their own group. And in terms of the learning the children the specific tools that experts used really empowered them with the skill set to complete professional work. Showing them how to complete mental, land use and legibility maps really aided discussion, as they each had one large map per table and they were able to discuss all the different elements that they wanted to talk about within their area. And the Photoshop workshop was an excellent experience, which the children really enjoyed and grasped very, very quickly. And this really allowed for them to fully visualize their ideas, giving them overall confidence in their ability and excitement of what their area could look like. And for the interactive methods, using Google Earth, it's a free tool that everybody can use, especially on the interactive screen, which thankfully we were lucky to get a loan of from Queen's University. And the use of post-it notes were great, and it's very, very easy to use and low cost, and anybody can do this. And limiting to one note per page really allowed everybody to participate. And the photo elicitation with the disposable cameras was probably the most favourite exercise, as they were able to be independent in this process, photographing their natural journeys. And then finally, the use of iPads, laptops and smartphones, which the majority of them did have, were essential when looking for visuals for their ideas, and they started to work on these as well when they were home, looking at examples from Pinterest. And knowing that they had to present their work at the end, it really gives them a goal and a sense of pride in showing off their hard work. And simply cutting and pasting everything onto large pages was the easiest way to do this, and it encouraged everyone to work together. And lastly, when things are fun and children are empowered and supported, we can all really learn from them. And these are some of the stakeholders that were involved in the project. And finally, just to conclude, the research is currently being funded by the Northern Ireland North East Doctoral Training Partnership. And current research, I'm looking to select specific sites located in and around interface areas, engage in multiple child-friendly workshops locally with community organisations, and to gather innovative solutions, hoping to design a vision and strategy for sites with policy recommendations. And then this will lead me to evaluate the success of the child-led approach, analysing the effectiveness of each method used. So if anybody would like to participate in future programmes, please feel free to drop me an email or contact me. And again, if anybody has any questions, advice or comments, please feel free to drop them across and I'm happy to answer. Thank you very much.
Thanks very much, Rachel. That was a fantastic presentation. A lot of energy running through your presentation there, and a couple of questions, just observations from me. What age were those kids? Some of those kids look like primary school. Were they?
Yes, they were from 7 to 15.
Yeah. So 7-year-olds are, that's primary 4 or 5, maybe.
Yeah.
Is it hard? I mean, was it hard to engage kids that young? I know it was a wide spread of age, but it looked like they were truly engaged in the process.
It was challenging at times, and that was when we found it was best to separate the groups, because the older ones weren't mixing well with the younger ones. So once we kept the younger ones together at a separate table and the older ones together, then they were able to work well. And it is largely because it was in their local community centre, so they already felt comfortable in that environment. And I've known a lot of them locally as well. So, in terms of ease, it was a lot easier.
Yeah, Belfast Healthy Cities has been engaged in trying to develop child-friendly policies, child-friendly cities, and I think we've been involved in taking kids, even primary school kids, down to City Hall to meet councillors, meet the Lord Mayor, meet environmental planners, and they're not shy about making their views known. Did you find that as well? They're quite willing to put their hand up and have their say.
Yes, they're extremely forward, and it's this reason why they are the best people to negotiate with, because they are the experts and the future generations are going to be using this spaces. There's no point adults constantly designing everything around when they're not going to be here to use the space eventually. It's going to be the younger generation.
I think it's really important to get that partnership approach between the statutory agencies and the work you're doing. If we ask kids what they'd like to see and then they don't see an outcome from that, that can be quite
Yes.
like that could lead to a disconnect actually from community participation.
Yeah, that's the biggest challenge.
But the one of your final slides there was a really optimistic one when it showed that the path had been put in. So the kids could literally see, people did listen to me there.
Yeah.
But the next slide, unfortunately, Rachel, brought us back down to earth with that. It was headed lockdown, and it was obviously quite serious civil disturbance there. Is that like, what's the update?
That has calmed down, and it was the summer months are very tense for interface areas because of the largely bonfire activity, and unfortunately that is just the realistic view of what still happens in these areas. And it's very important to highlight that, but it's also very important to bring it up. This is why these sites need looked at, because a lot of them are just being plastered over it and ignored, and there's so many pockets of dereliction where a lot of antisocial behaviour is still currently happening.
Yeah. So one of the questions we have in from our audience is from Bernadette Cullen. Is there a plan how to move forward given the problems which did occur? And can you still keep the children involved in developing any new plans? Or can you keep a fresh intake of children? Rachel, is there any ongoing plans there?
Well, the good thing is that Northern Ireland Water, so they have put forward kind of a proposal for a SUD scheme, and it's being funded by, I think, Living with Water and Belfast City Council. So they have currently appointed a consultant, which, it's very, very good news because it means there's a bit of movement. And during this process, he has made it very apparent that he wants to include and engage the local community through each step, because they want the children, they have seen this project and they want the children to be engaged and try to come up with some ideas of their own and see what can be put in. But again, it is all down to resourcing, but fingers crossed, hopefully that does transpire. And it is just about time. This could take a year, 2 years, and then the children who were involved in the project could be a lot older and less disinterested, but you can only try at the same time.
And that area that you're talking about, I mean, it's very urban. It's got the Royal Victoria Hospital site. It's got a lot of retail outlets, probably high density housing. It's got Grosvenor Recreation Centre, Dunville Park. But what you flagged up there was just that extra bit of green space that people could view as their own and really make use of.
And it is huge. And the other great thing is that the Forest Meadow Greenway, they have actually picked up on the site and its proximity to the Greenway that they're proposing to connect from north to west, as they're proposing it runs right along the back of the West Link. So the Route B hopes in the future to possibly remove part of the wall, and people could be signposted into what could be, the first SUD scheme in Belfast, fingers crossed, but you can only hope for something like that. But it's starting to look more realistic because of the pressure being put on and the more attention that the site has been given.
Great. It sounds like you'll be staying involved as well.
Yeah, of course.
Very good. Thank you, Rachel. There's a couple of other comments come in that really are probably for Belfast Healthy Cities, I suppose yourself, Rachel, around Arthur Atchison has pointed out that he's been promoting the entire town and city centres as green space town parks. Can BHC get involved in making this happen, such as happened on the Ormeau Parklet, which Belfast Healthy Cities was involved in, and they featured in our awards for Christmas as well, and a question around the budget involved in NI Water. But I think Joan might address those comments or questions in her roundup at the end. So Rachel, thank you very much. Good luck with it all. We will certainly be interested to hear how it rolls out in the future as well. So let's stay in touch with Belfast Healthy Cities, and we'll certainly stay in touch with you as well.
Perfect. Thanks again, everyone.
Thank you. Okay, we've had two of our presentations now, and I would just remind people, if you're going to tweet, please do, and use that hashtag Healthy Belfast. And you can also, some people are submitting questions and comments into the Q&A function at the bottom of your screen, so please keep doing that as well. And Deepti, I'm going to bring you in just a few seconds after I introduce you, so if you could get ready for that. Dr. Deepti Adlaka is a lecturer in environmental planning at Queen's. A lecturer in environmental planning at the School of the Natural and Built Environment, which featured in our last presentation as well. She is a recipient of the Fulbright Fellowship and obtained her PhD at Washington University in St. Louis in the United States. And her research, which we're going to hear something of now, has featured in a TED Talk on the BBC and in some very high-profile journals, Scientific American and the Conversation. So we're lucky to have you with us. Deeply, we appreciate your time, as we do with the other two speakers. And I'm going to hand over to you now. Thank you very much.
Thank you, Brandon. And for the sake of the presentation, I'll turn off the video as per the instructions. So there we go. I'm going to talk today a little bit about the role of physical activity and the design of neighborhoods, especially in the context of COVID and the discussion around the recovery from COVID and what we should be focusing on in the field of urban planning. So during the pandemic, we've all had our geographical boundaries quite limited, and the power of the neighborhood has really come to light. For city residents, we've all realized that we need equitable access to neighborhood amenities, shops, stores, parks and green spaces. And for those living in extremely high density cities, sometimes this has brought up a debate. We know all these features have been very critical for all aspects of our health, whether it's physical health, getting outdoors for a walk. Our emotional health has suffered with being indoors, locked up, not being able to socialize. So the role of physical activity and COVID-19, I think, has not been stressed upon enough during the pandemic. When we initially went into the first lockdown, we were allowed to go out for a walk. And then slowly that eased up. But I think in the last few months, what has been extremely clear is that physical activity has beneficial effects for our immunity. And this is extremely important at this time. It also can reduce stress, inflammation, and it has overall beneficial effects for mental health and emotional well-being. And even though physical activity is considered an essential activity, we have not seen any evidence of educating people directly on the benefits, and the role of our neighborhoods and the design of our neighborhoods has played an important role. So how do we build on this, and how do we recover better from COVID-19, making sure that our future neighborhoods are designed well to support our daily activities? I also wanted to bring up this tweet from last year, March, nearly a year ago now, by the governor of New York, Andrew Cuomo. And he brought up this, I guess, his thoughts on the density level in New York as being destructive, and the fact that it has to stop, and it has to stop now. As an architect and urban planner, this just made me step back a bit and first of all ponder whether density really has a role in the pandemic. And the second question was, how would you even reduce the density in New York? And that's not really practical for a lot of our downtowns, our city centers. So we were, it actually provoked a backlash among a lot of urban planners, and several of them wrote op-eds, editorials, saying that this backlash against cities is dangerous, and the fact is that we need to embrace density right now and design our neighborhoods better and more activity friendly. So there wasn't really any evidence to base these arguments on, and it felt like there were two groups constantly at loggerheads with each other, wondering what is the role of density during COVID-19. So a colleague and I, we started discussing this, and we decided to just delve into it a little bit. And we plotted the population density and per capita COVID-19 cases, or the infection rate, as well as COVID-19 deaths. And you can clearly see, so this is a correlation, and this is actually a negative correlation. So there was no correlation between density and COVID-19 cases or death rates. Now this data is from last year. Things have changed quite a lot, but we are still confident that these findings will hold true at this time. And the reasons being, you have to make a clear distinction between density and overcrowding. A lot of the outbreaks that we've seen have been in places which are quite densely packed with people, leaving little or no room for improvement. For example, industries, factories, meat packing plants world over have been responsible for these outbreaks. Whereas density, it is the geographical spatial indicator of the number of people living in a unit area. And if those areas implement rigorous public health guidelines, then we've seen the evidence that density does not play a role in the spread of the pandemic. So we dived into the net effects of what these attributes are. And our conclusions are that when it comes to measuring these built environment attributes like density, mixed land use, public transportation, your street infrastructure, access to parks and open spaces, all of them have favorable effects, not just on non-communicable diseases like obesity and diabetes, but also during infectious diseases. Public transportation is a sticky point because we've all seen the reluctance to go back because you're in closed doors, and there is a chance that there will be transmission in those areas. However, now new research is showing that with rigorous public health measures, even those effects can be avoided. And the bottom line, I think, to underscore is that cities are a boon for public health, whether it's a pandemic or not. And as public health experts have said for decades, people who live in a city are more likely to walk and cycle more, and they live closer to amenities like grocery stores. They also have better access to healthcare facilities, a greater concentration of hospital beds, and faster emergency response times. So urban density is really not to blame. And I think as planners and as built environment professionals, this is an important fact to bear in mind. So these are some of our conclusions, and the article is open access, and this is the title. So you're free to Google it or send me an email and I can share the link to this article. And we also went into the recommended mitigation measures on public transport, such as limiting riders, obviously mask wearing, sanitizing and cleaning the vehicles often can limit the spread. So public transportation as well, we shouldn't go back to getting into the car and adding more congestion to our streets. We also published an accompanying commentary in the conversation on why urban density is good for health. And this is linked here as well. So you may want to have a quick read at that. This is written in much simpler language and not in very research intensive language. So I would encourage all of you, if you're interested, to pull this up. We then also, along with a couple of colleagues in the US and in Nigeria, we looked at outlining what the next steps should be for both physical activity and public health. With the conversation around building back better, the recent OECD report highlights 3 important points on where we should be focusing on. And all of these are overlapping with city planning and public health. So we look at reducing greenhouse gas emissions, reversing the biodiversity loss, fostering innovation for behavior changes. And I think across the UK, we've seen several cities take steps to do this. In London, there have been pop-up parklets, low traffic neighborhoods, car-free streets, efforts to reallocate road space and encourage active transport. And all of these measures should continue on. And I think we need to build this culture around shifting the conversation on car dependency to active travel. In this specific piece of research, we outlined both policies and practices. So not just what research should do, but also what in the practical world, what we should do based on the behavioral epidemiology framework. And it really drives home the point on how human behavior can change based on these interventions in the environment. From a city planning perspective, we outlined several general recommendations on what researchers can do, how to capture data, the role of big data for practice-based interventions. We've highlighted the role of GIS, and some of Queen's University students have also taken this on as their thesis projects or their assignments during classes. So I'll be happy to share examples from that. And this is really driving home to the point of how do we move from here on? We have the tools, we have the research here, and it's a question of how we implement this into practical policies and guidelines. These are some of the maps that I found out on the Low Traffic Neighborhoods website, and you can clearly see here in Belfast, there are some interventions around the city centre that have been implemented with new road layouts. And I think it would be fantastic if we could see this spread out all over the island, and even in smaller towns and cities, simple interventions to expand road space, making sure the community is involved in these decisions around highlighting opportunities for safe and spatially distanced physical activity would be ideal, given that we are still in lockdown. And from a research perspective, we've set up an international network, and it's a Google document which we invite researchers, policymakers to look at the studies that are going on, connect with each other, and use the evidence there to conduct studies with transdisciplinary teams. So that's it in a nutshell. These are the two projects that I've been working on, and I'll be happy to take questions.
Thanks, Deepti. Can I start, Deepti? There are a few questions and comments that have come in through the chat as well, but I just wonder, there has been some behavioural change which has come about directly related to the pandemic and how people responded to lockdown and responded to having quieter streets. Maybe they felt safer to walk or cycle on quieter streets. But I wonder, is there any research done? How can we take that short-term decision to switch to a more sustainable mode of public transport and getting around? How can we make that a more longer-term one? It's not related to the pandemic, but it's just related to making the city better for everybody on a longer-term basis.
Yeah, I think it really goes down to policies and long-term intentions by the city government. We've seen that happen in cities in Europe. For example, the Paris mayor has been quite vocal about her support for active travel, and there've been some really radical changes in Paris, Barcelona, and these are long-term changes. They have been, I think some of them were even introduced before the pandemic kicked in. So I think it is both a combination of top-down and bottom-up approaches where the communities can lobby for it, and then it also is the leadership from top-down and actually making sure that the policies are implemented long-term.
Yeah. You might have read, and anyone who's interested in this topic should go back and read. Last Saturday's Irish Times had a supplement given over to what might Dublin look like in the future post-COVID. And I must say, if you simply substitute the word Dublin for Belfast, almost every part of and almost every article could easily have applied to Belfast and to Northern Ireland. One of the points made was that people are very used to working from home now. They're very used to having conferences like this online, but they physically go to one space. But people will also still want some element of human interaction. So we'll probably end up with a blended model, sometimes working from home, sometimes working from your office. But we certainly probably won't have a need for the kind of office blocks which we've been building up until now. And one of the articles, it was David McWilliams, the economist, posed the question, what do we do with office blocks then? Can we turn them into housing? Can we turn them into art galleries? Because Belfast, the city centres are changing. They're never going to be centres where people go just to shop anymore. They're going to have to be centres where people come in to do cultural activities and leisure activities as well as retail activities. Are those things achievable, Deepti, or are they sort of daydreams?
No, I think they are certainly achievable from, my first degree was in architecture, and from that standpoint, I think internal layouts of buildings can be changed. I mean, we're not talking about complete demolitions here. We're talking about internal changes, and changing that should be, from an architectural standpoint can be done. But from an urban standpoint as well, one of the attributes that we measured in our studies was mixed land use. And I think we all know from our experience, when you're limited in geography and you need to get, a pint of milk or go for a walk to the park, you want everything within your neighborhood. And that's been so important. So the role of mixed land use, and city centers are the perfect places for that. You have your retail at ground level, you have some shopping, and then you have apartments, mixed dwellings. Cities like Vancouver have been leading the way on that, and their urban policy documents actually list the number of dwellings and list the percentage of mixed land use.
Okay, yeah, you're right. It's a challenge, and in fact, your presentation was very challenging as well, but that's a good thing. We all do need to think about our city, how we live and work in it, and how we share it as well. You did flag up the inequalities, the impact of inequalities, and how some areas and some demographics fared worse than others in the pandemic. Again, is that something which should feature? Healthy cities would be very aware of health inequalities across the city, and life expectancy in one part of Belfast can vary widely to another part of Belfast. Is that something which needs to be part of urban planning in the future as well?
Yeah, definitely. I think overcrowding is a key issue in some communities, and including aspects of affordable housing and gentrification considerations
Yes.
as well is extremely important. Quite often we find that cities that rapidly transform their neighborhoods into walkable, activity friendly, then the rents go up and people are priced out of living there. So I think it has to be a very careful balance of introducing affordable housing and neighborhood redevelopment.
Okay. And finally, Deepti, where do you stand on the debate that Mayor Cuomo initiated with his tweet?
Oh,
and
our research clearly showed that there is no correlation there.
Yeah. All right. Look, thank you very, very much, Deepti. It's a very, very interesting, as I said, a challenging presentation as well. But it's important that we all think through these issues. Just before, I'm going to bring Joan Devlin in to do Joan is Chief Executive of Belfast Healthy Cities to do a sort of a wrap up and a little bit of a look back at the three presentations. Just on the question and answer forum. Well done, Anne Madden. As she says, it's not a question, but she's highlighting Sustrans project to recruit volunteers for the 4th Meadow Greenway project in North and West Belfast. Anne has given us a link to that project as well. I'm sure we'll be able to put that on the Belfast Healthy Cities website, Joan or Anne Cusker, if anyone wants to volunteer. And Arthur Atchison has come in again with what an interesting phrase. The second presentation, referring back to Rachel's presentation, referred to what used to be called SLOAP, SLOAP, which is space left over after planning, or in Arthur's view, it's space left over after road schemes. So that we probably do need to reflect on the prevalence of road schemes and how planning incorporates whole neighbourhoods and not just space which is currently being used, and therefore leading to space which is left over. And finally, Colin Delaney has said there are many challenges for people with disabilities coming out of lockdown, which he thinks presents an opportunity to future-proof more accessible streets, which again, a challenge for something for all of our policymakers to take on board. So thank you very much to Deepti, to Rachel and to Ruth. And I'm just going to ask Joan if you're ready to come in there, Joan.
Yeah. Okay, thanks very much, Brendan. And thanks very much to Ruth, Rachel and Deepti for their presentations, 3 excellent presentations, and really interesting learning from all of them. And I think at the beginning it's important for me to say that we really value the relationship with Queen's University. We've had a long-standing relationship, and Ruth is actually now a board member as well. So really appreciate it with a number of projects. But Ruth's presentation, and I have to say the presentations that were presented at the WHO annual conference online in December were really very well attended, and the comments back were really positive. But I think from Ruth's presentation, I think we don't actually see enough of this, Ruth, the social return on investment in green space, or the value of green space. And I think COVID has demonstrated the value of green space, good quality green space, open space to populations generally, and to population health. And I thought it was lovely or great to see the way it looked at the full picture, it looked at the health benefits. I mean, it's a public health issue, but you looked at employment, at housing, at tourism, land and property prices, all of which actually relate to quality of life. So I thought, and reduction in crime, which actually I think also potentially had some link to the work that Rachel presented as well. Potentially there's some crossover there. So really, demonstrating a substantial health gain with that, and really a worthwhile economic investment. And I think it's excellent, Ruth, to have it as an example, and to have it as an example that we share both globally, but also locally as well. So thank you very much, Ruth. And the point that was well made is about public health being a long-term investment and the interventions being long-term investments, 2 key points. Rachel, thank you very much for your presentation. It's an area I know very well. I worked there, started my career in Roden Street many, many years ago. So I was able to identify with the area completely and the walls, but again, demonstrated the value of engaging children. And as Brendan has said, we've been engaging children probably for the last 10 years and have brought over some really good examples from some of the other European cities and engaged the children and engaged a lot of the politicians in it. And it's good to see, I see Neil Galway is one of the participants from Queen. So Neil has actually very much promoting that. And it has become almost an acceptable, it's an acceptable term to use, child-friendly places or child-friendly cities. 20 years ago, it wasn't really on the agenda. So it is really good to see that. good to see the positive environment that was created, and then how that engages other people. It's such a shame about the negative impact that you showed us as well, but also from that Bernadette's question around what's the future, the positive sort of future from that. So I thought it's an excellent piece of work. And what I also liked about it, and this is about exposing areas that experience inequalities, you know, the children were exposed to being in Queen's University, which is something I know children from that area would never get the opportunity to do, or very rarely. So I really enjoyed it, Rachel. Thank you very much indeed. And then the final presentation from Deepti. Thank you very much. And again, Deepti, and I thought the debate that you have around density and overcrowding was interesting. It's not always a different, we'll not always make that difference. And the argument, the good research that demonstrated density isn't related to COVID cases or COVID deaths. Quite a challenge. We all know the significant challenge it is to move people out of their car and to increase active travel. And I suppose when we think about it, it is mayors across some of the cities that we've seen, we see it on social media, that have authority within their local city that are making a success of it. Many of you will know, you've heard me say, our infrastructure is quite different from a lot of the other cities we work with in the European network. But the minister here has established a walking and cycling group, which Ruth and I actually both sit on. And I mean, it's a little bit, the process is much slower than we would want. But these only move in incremental stages, as we know, because of the traditional emphasis on roads. But I thought it was great to see, the examples from other cities as well, and that whole point that you made around mixed dwellings. I mean, there are lots of. I think one of my first trips to healthy cities in Europe was in Vienna, and I was just at the time, it was a long time ago, but it was very much that combination of sports like tennis courts in the middle of the city, people living above the shops and above the restaurants, very much that mixed sort of a dwelling with city. So great to see the initiatives from other cities, but brilliant for us to have such good learning at home as well. So thank you all very much, and we look forward to the next stage, and more so with Rachel's and Deepti's in terms of the results with those research. So thank you again. Just my answer to Arthur, I couldn't get answering on the question and answer for some reason, but very happy to be involved, Arthur, with some of the work that you've highlighted on the question and answer, and to link this into some of the work that's going on active travel across the city and within the region. So thanks a lot, and I'll pass you back to Brendan.
Thank you, Joan. And just to reiterate, thanks very much to all of our speakers. Three very, very interesting, informative and challenging presentations. And thanks to all of our attendees. We have actually managed, despite having 3 presentations where last week we had 2, we have brought the seminar home just within the time frame as well, which is well done to everybody. Just a reminder that the presentations and the recording of the overall event will be uploaded to the Belfast Healthy Cities website, and also the evaluations will be sent out this Friday. It only takes a couple of minutes to fill in the evaluation. It really does help us form future such seminars, because we want to present seminars which are useful to you, which grab your attention, and which encourage you to come back. And we will be back throughout March, April and May, when we will be taking a look at phase 7 of the work of Belfast Healthy Cities within the European Healthy Cities Network of the World Health Organization. So keep an eye out for all that. Between our email and our social media, we will get you one way or another, or maybe every way, to let you keep you informed of those future seminars. Just thanks for coming today, and thanks to our speakers.
Brendan, important to thank Anne as well for doing all the work.
So, of course, to thank Anne McCusker, who is the backbone of this event, and sets up all the presentations and sets up all the IT. And without it, we wouldn't have a seminar. So thank you, Anne. Thanks, Belfast Healthy Cities team.